Double your defences by getting your COVID-19 and flu vaccines this winter. They're free for over 50s, those at clinical risk, pregnant women, carers, people with learning disabilities, as well as health and social care workers. Don't delay. Get both vaccines now. It's safe to have them both at the same time. Double your defences. Get vaccinated, get protected. Go to nhs.uk to find out more.
This is our People podcast, telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
So today is International Women's Day. It's March the 8th and my name is Fiona Thompson and I'm a Communications Officer with the Trust, and I'm delighted to join Kath Griffin and Phillipa Poole with me for today's episode. Could I start with you, Kath? Would you like to tell us what your job involves and your journey into your role?
Yeah. Well, I'm very privileged to be the Director of Human Resources and Organisational Development here at the Trust. It's quite a broad role. We cover everything from occupational health, OD, learning development, recruitment, payroll, all the interesting parts of the role. And Phillipa will talk a little bit about inclusion, which is also within my team. I guess my journey has been a long one. I never set out to be the Director of Human Resources and Organisational Development. My first job was selling stamps at the post office counter. But I've been really lucky throughout my career to have opportunities to do learning, development whilst at work, and I took all those opportunities whilst I could, and I've been really lucky to end up in the position that I am today.
So where did your NHS journey begin?
It began here. It began in the former City Hospital Sunderland Trust when I joined the Trust from Social Services in Sunderland. So my whole NHS experience and career has been here with this Trust.
Fantastic. And Phillipa, you joined us previously for a podcast, and that's definitely worth a listen. People want to go and have a listen back to that one. But tell us about your job and what it entails.
Yeah, so I'm the inclusion lead for the Trust. So it's about making sure that our services and any opportunities that we put forward are fair and accessible. So it's about how we make improvements for our staff and for our patients, but it's how we listen to the staff and the patients to make sure that the improvements are kind of develop together and we meet people's needs. So we do lots of promotion around inclusion, we do lots of work around tackling inequalities, and we work with our patient experience team too to make sure that we're supporting patients.
Brilliant, thank you for giving us that insight. And we're very pleased to say that we've achieved the continuing excellence level at the Better Health at Work Awards. So would you be able to explain to me both a little bit about how that's linked to our support for all of our workforce?
Okay, so maybe give a bit of background to how we got there. So don't want to take the credit for it because it's our wellbeing team, which is part of the Occupational Health Department. They've worked towards this submission throughout the year. The award basically assesses the health and wellbeing support that we offer to our employees, evaluating the commitment, promotion and innovation towards creating a healthier workplace. That's the real focus of it. So at the end of 2022, we achieved this award. The level not only recognises the importance of organisations sustaining progress, but it also encourages us to use our experience to start to support other organisations that are maybe not on the Better Health at Work Award journey. So really looking at our partners, whether that be large organisations or small, and trying to encourage them to do the same.
Brilliant. Phillipa, is there anything as part of your role that squares up with that?
Yeah, so we work closely with the wellbeing team, and in terms of inclusion and some of our priorities, we work around wellbeing, we work around improving access and around fairness, so tackling inequalities that are in the system. So we do lots of work with the wellbeing team, and we've supported with the Better Health at Work submission, and we'll continue to support as we do the maintaining excellence work, and some of that's about how we engage our local communities and our local groups. We work closely with our patient experience team. We've had areas where we need to make improvements, maybe that have come through the complaints process, and it's how we work with and together with patients and with other services to make sure that we're making those things better for people when they access our services. So, for example, we've worked recently with patients from Sunderland People First who've helped us and supported us to get the Change in Places facility. We're also doing some work around the Accessible Information Standard, which is it's very much about making sure that people's needs are met when they come into hospital or into community services.
And speaking of International Women's Day, today marks a year since we launched our own Menopause Pledge. So that has a number of different strands to it, so I'm just going to touch on those so we know where we're going. So we, as part of this, said we wanted to recognise the need of our people, so that's staff as well as patients experiencing the menopause. We also set out how we were going to create a learning culture to enable managers to support their employees affected by the menopause, and also we want to make sure we can enable an open, honest and safe space for employees to discuss the menopause. So do you want to touch on what difference you hope it will make in the long run?
Yeah, well, I think a lot of the work that we did came out of conversations with our staff. So in the last year we've listened and done lots of work around the big team talk. We've developed resources and guides, so we've got support and resources guides for staff and managers on our intranet. Our wellbeing team have developed health checks, and there's lots of information that can be found, and you can either staff can find it on the intranet or by contacting the wellbeing team. And in terms of patients, it's making sure that we're supporting as part of the wider system. So I've just recently joined the South Tyneside period poverty work that we're going to start looking at as a system. So there's lots of work ongoing in terms of wellbeing in its holistic sense for all staff.
So Phillipa mentioned the big team talk there. That is how we engage and talk to our staff about how we are and where we are going as an organisation.
Yeah, it's very much linked to the staff survey and making sure that we're listening to and responding to feedback. And it's very similar, we do equivalent for our patients. We've got the family and friends test, we've got lots of feedback mechanisms, and it's just making sure that we continually look to improve as an organisation.
And I think as well, just to make sure that we know what our staff are thinking, what they think about the organisation, what they think we can maybe do for them, and that's where a lot of the action, if you like, that came out of the big money team talk month.
Yeah, which was a project within the project that just looked at financial well-being and health that's at hand as well.
Yeah, absolutely.
Kath, is there anything you would like to add there?
I suppose just a couple of things, and with some of that engagement with staff, we got a lot of feedback. We were lucky enough last year to get a really hot summer, but that had a big impact on some of our staff working in the wards. The uniforms were extremely heavy, and whilst we tried to put sort of short-term fixes in by, allowing staff to wear t-shirts, etc., there really is something more long-term we need to look at. So we have started a piece of work looking at uniforms to see if we can find uniforms that are a bit more lightweight, easier to wear, breathable fabrics. We've had some from some suppliers, and they've been tested by some staff on the ward so far. Now, we don't think we've found the right product yet, but we're still working on it, and hopefully we'll have something in place this summer. We're also aware that nationally the NHS is looking at the uniforms across the NHS, and something that's actually already been fed into that piece of work is to look at the fabric and make sure there's lightweight. And that's not just for women, who are going through the menopause. That's for, some people just feel the heat very easily, and it's to make people feel as comfortable as possible at work.
Our hospitals can be really hot as well. We know when we're out and about it's exceptionally warm in some places.
Absolutely.
And I know some of our staff prefer darker materials as well, because they find that puts their minds at ease if they are having their period, and it just gives them a
And that's how some of the conversations came about when we initially started having conversations with staff about people have had accidents at work where they've had a bleed and they didn't know that they were going to have a bleed due to the menopause. So it's making sure that staff feel that they can have a voice and talk about things like this, because it does have a lot of stigma, it does have a lot of embarrassment sometimes associated with it, so it's about how we can support staff while we're at work.
And I think on that point of the uniform, staff just need to know that they can get trousers, so there are navy blue trousers, that staff can get a little bit of tunic as part of a uniform if that's something that would make them feel more comfortable and also maybe more relaxed whilst at work.
And we supply sanitary products and incontinence products for our patients, so we're kind of making the link there with our patients and our staff.
And we know that within this policy we've looked at the fact that 1 in 10 women leaving their roles because of the menopause. So what are we doing as part of that?
So we've done lots of work around the development of a policy. We're just waiting for some national guidance before we roll that out. But what we've done is develop lots of the tools that we've already mentioned. And I suppose we'll just continue to have the conversations, but one of the big things that we're going to roll out, hopefully from today, you'll start seeing across trust sites, is the supply of sanitary products. So we'll make sure that from today there'll be key sites that will be available on the intranet. You'll be able to find the details there, and we'll get them out far and wide. And we would ask that we maybe have a representative from some of the different sites to get in touch with us to be the contact, so that when stocks need replenishing, we can facilitate that. So more information will be coming, and it'll be available on the intranet and via the different communications methods.
Yeah, and I think also touching on the point Phillipa mentioned earlier about information, we've got guides for managers and for staff around the menopause. And I think it's important that through wellbeing conversations that managers are having with their staff, that if issues come up, if they've got concerns and they see some of the symptoms on some of the people within their team, that they take the opportunity to have some of those conversations. Some people might not want to talk about it, and that's entirely their right, but at least recognising that there is an open door, they can have a conversation and they can find where they can get help. Because it's not an easy thing to get through.
No, and if in doubt, it's just encouraging people to seek support if they need it. Go and see your GP, or have conversations if you've got family members or loved ones that you think might be going through something like this, or anything really in terms of well-being. Make sure that people are seeking support and being proactive around their well-being in general. There's the new ICS Menopause Support Group, and it's psychologist-led, and I think it's just really positive that we're working as a region really to try and tackle some of these issues.
Yeah, and through that ICS Hub they've been running a programme or a group for colleagues across the region and how they can navigate the menopause. It's a 6-week programme, and it'll be run by 2 therapists, and it'll be online via Teams, and it's going to be based around 3 strands, around intervention, cognitive behavioural therapy, compassion-focused therapy, and a mindfulness-based approach. The idea is that really that you get the opportunity to explore how that can help you on your journey. We provide the information for our staff on the Trust intranet, but the programme is going to take place through April and May, and we'll include the links for that for staff if they're interested.
It links to the fact that as part of the organisation though we're focusing on Women's Month this month and it's International Women's Day today, this forms part of a wider campaign of wellbeing activities and topics that we'll be highlighting and doing a spotlight on. So November is we're going to focus on men's health, so that may be around prostate, it may be around International Men's Day, but it's just making sure that we are looking at a variety of topics and making sure that staff and our patients have got an opportunity to know signs and symptoms and get a bit of awareness raising done.
And what are we doing to raise awareness of the menopause right across our trust, and how are we supporting family members and loved ones who might be close to somebody who is going through the menopause?
So colleagues who are not currently or who will never experience symptoms of their menopause, they can also be affected. So whether they're a partner, family member, or even a colleague who might be working alongside somebody who's gone through the menopause. So raising awareness, which we've mentioned before, that's really, really important, so that we recognise the signs and we can offer support and understand people's behaviour at particular points in time. The more information we can provide, the better equipped we are to deal with any issues that are actually brought up and raised. Phillipa has mentioned some of the other health promotion and International Men's Day being one that we'll do later on in the year, but we also need to recognise that we've got some male staff who might experience male menopause, which is also known as andropause. There's not been as much research on this as there has been on female menopause, but some men we know will experience similar symptoms to female menopause, including things like a lack of energy, changes in their mood and concentration, erectile dysfunction, and difficulty sleeping. And we'll look a little bit closer at that when we get to Men's Health Month in November.
And we're also helping to address period poverty, which we've already touched on. But what are we doing, and what conversations prompted this project?
So some of the conversations began last year with staff. So we'd had staff come to us and say that they'd experienced menopausal bleeding when at work, and they felt embarrassed. Were there any things that we could do as an organisation to support? And we absolutely agree that we wanted to do something, so we developed the pledge last year, and that was the start of our work really. So in the last 12 months we've been developing some of the guides we've already talked about. And from this month we'll be making sure that sanitary products are rolled out over the next week or so, or a couple of weeks, and they'll be available for the next 12 months, just to make sure that staff have got essentials really available where they work.
And that length of time it's going to be rolled out just gives us a chance to evaluate and work out where it's gone right, and improve things if they need to be.
Do a little bit of evaluation at the end of it just to see.
This is going to run for 12 months as a project, and then we'll be evaluating it and see where it's got
and
to.
See where we're at, at 12 months, and then we'll just see how things develop further, and it might be that we do something more as a region, but we just wanted to make sure that we had essential products for our staff going forward.
I think the other thing to recognise as well is that in the current financial climate and the cost of living crisis, we know that that's hitting people hard, really hard. And sanitary products, some people might think that's something they may be able to save some money on. So we don't want people to find themselves in that position. We employ 83% of our workforce are female, and we want to make sure we're providing as much support as we possibly can at times of need. So that is also part of providing sanitary products across the organisation and the rationale behind it.
In terms of the cost of living work that we've been doing, we've for our workforce, we've got our care coordinator Susan, who does some fantastic work in terms of support for people who are carers. We've just recently launched our credit union for staff, and we're also, the wellbeing team's just about to do some financial planning for parents-to-be. And there's also lots of resources available for our patients as well, because we know it can be challenging at the minute, so we do lots of work with our partners to make sure that we're raising awareness of how people can access support, and we're very mindful that it can be quite challenging at the minute.
And as much as anything else, all those things are fantastic, but the other thing is sometimes you just run out, or you caught unawares, or you think you've got a supply and you haven't, and it's an anxious time when that happens.
It is, and sometimes we've had stories from staff that said if they were only female within a whole male team, it can be embarrassing to ask for something or to have to pop out. So actually this takes some of that stigma and the embarrassment away, and it's just an extra support for staff.
We started doing health and wellbeing checks for our colleagues. So this is screening to detect health conditions. What does that involve?
Okay, so the health and wellbeing checks are actually aimed at identifying individuals who are at risk of developing health conditions. That might include stroke, heart disease, kidney disease and type 2 diabetes. The check includes screening on a whole range of lifestyle factors, and also carries out measurements including your height, your weight, cholesterol, waist circumference, blood pressure, etc. So it's a great opportunity to come along and have that done actually in the workplace. Once the checks are done and you've got your report or you've got your results, then the team will offer advice and signposting to help you lower your chances of developing any of those conditions above that I've just mentioned, as well as supporting you with your overall health and wellbeing. And for our staff, there's information again that will be on the intranet, and people can contact the department, the Occupational Health Department, and arrange their check. For the general public, they can seek advice through their GP for a health and wellbeing check, and it's something that we would encourage.
So we're also doing quite a lot of work to keep our staff fit and healthy, so would you like to touch on just what that involves?
I suppose we've touched a wee bit on the health and wellbeing checks and what we're doing there for staff. We also have a stop smoking campaign where staff who want to quit can contact occupational health and get involved with that. I think quite often for people who do still smoke, you'll hear people saying, I've already tried. I think the feedback and the research would say very few people manage to give up at the first attempt. So really, if it's something that's still there, then maybe have another go. And as I say, contact the department and they can offer some in-house support. The other thing that we've got in place, free of charge obviously, is staff wellbeing walks. So they take place on different sites across the trust. There are team leaders or walk leaders, I can't remember quite the exact title, and they'll meet people at different points, whether it's the education centre at Sunderland Royal, at the Ingham Wing, up at the Eye Infirmary, and they'll have a walk planned. They're promoted on the trust intranet for staff and on the Facebook page, and there's also walks that are taking place at weekends as well, involving staff and the dogs and maybe some family members. I think it's a great opportunity not only to get fit but also to get to know other people in the organisation and take that time away from the workplace just to have a little bit of fresh air.
It does make you feel better, and I know that our staff have shared lots of lovely photographs of them
Yes.
out and about. It's really nice to see little smiling faces, and they're obviously making friends with each other, and it's really nice to see the feedback that they give them. And it's a really simple, free thing that people can do.
Absolutely.
Yeah.
And it helps your physical but also your mental well-being.
Always feel better after a walk.
Absolutely.
March is also Ovarian Cancer Month, so what are we doing to raise its profile within our own trust?
Yeah, which is why we wanted to celebrate the whole month of March around women's health, really. So our wellbeing team are going to be promoting signs and symptoms, what to look out for in terms of... no, that's the same thing.
Take a deep breath.
So in terms of the whole month of March, we wanted to celebrate women's health and promote and raise awareness of signs and symptoms. So the wellbeing team are going to be sharing communications, resources, toolkits, lots of information via our intranet and Facebook, staff Facebook group, but also wider in terms of the trust communications that go out, so that we're raising awareness with our patients as well. So there's lots will be going on, so look out for it in the comms.
And Kath, you were among the first women to be invited on a winter wartime training camp. Would you like to tell us a little bit about that experience?
So as another part of the role that I have within the organisation, as I'm the executive lead for our armed forces work, and get to work alongside some of our staff who are reservists, and I was given the opportunity to represent the North East employers, not just the NHS but wider employers, with the Royal Marine Reserve, and it's their winter warfare training, and spent 5 days in Norway, deepest Norway, knee-high in snow, minus 20 degrees. So an absolutely amazing opportunity, something I'll never forget. So, yeah.
And what was it like? Because as part of that group, how many women were on it?
There was 6 women. It was a mixed group. There was 6 women who went on it. Shall I tell a funny story? No.
You can tell a funny story. I think you can tell a funny story.
So, all right. So there were 6 women on it. As I say, it was the first time women had gone on. And we slept in tents overnight. And when we arrived in the camp, we were escorted to the camp and told that the guys who were already on that training, the actual Marines, had spent all day digging out of the snow to make a toilet for the ladies, which was very kind of them. But unfortunately, when we arrived in the camp, they dug it in the direction of facing into the camp. So if you sat on the proverbial throne, you'd be facing all of the people in the camp. So sadly, all that work went to waste, but it did look good.
Did they do your new toilet?
No, we then had to do exactly what they do.
Right, okay. Well,
but it was an experience.
You're in survival mode, I guess, aren't you? Well, that must have been an experience.
And a half.
And you've also mentioned our reservists. So if anybody wants to listen to a podcast about the work we do with our reservists, we've done a really excellent chat with Alexander, who talked really well about their experiences, what opportunities it's opened up for them. They talk really brilliantly about that, so I'd highly recommend having a listen into that one if you've not already caught that episode.
And it's probably also worth saying that we do work with veterans as well. So if we've got any veterans in the organisation, we also have a lead for veterans within the trust. So there's information again for our staff on the intranet, and we do what we can to celebrate our armed forces and our veterans throughout the year. So a lot of activity going on.
Good. We're going to do a separate chat on that ahead of time.
Yes, we will.
Because it's definitely worth going into more detail about the work we've done, because we really have kind of broken ground with that, haven't we?
We have, absolutely.
And Phillipa, you are our first inclusion lead. So how have you forged your way in that role, how do you hope it makes a difference to representing all of our colleagues?
Yeah, well, I think I've always had an interest in inclusion and fairness. I've actually worked in the NHS for 15 years this year, so it's very much about working to support people and trying to remove barriers. Lots of my previous roles were around patient experience, so sitting within more of a workforce role as well as patients this time. It's been really beneficial. And just kind of working within the NHS, I just want to help people. I mean, I've got a family member who's got a disability and you have to fight for things to get support you need, and I want to make sure that within our organisation we're removing some of those barriers and making improvements where we can so that people don't always have to have the fight with the system. And in that case then I suppose it's making sure that our whole organisation thinks inclusively, it starts tackling and removing some of these inequalities, and it promotes well-being.
Because it's great when people do have an advocate, but some people don't.
Absolutely.
And it must be exhausting to have to explain
Yeah.
yourself and ask for basically what you should be getting all the time anyway.
Absolutely.
Just fairness, as you put it. And to round us off today, I wondered, seeing as it is International Women's Day, which woman has inspired you or supported you through your career, but also your personal life as well?
I think we're both going to say
I think we're probably going to go for a bit of a cliche. So yeah, there's loads of people, I guess, throughout our careers who've been there to help and support us and to push us along the way. I would have to say personally for me, it's not always been women. I've had a lot of male bosses, colleagues or whatever who've also supported me along the way. So my inspirational woman always will be my mum. I'm one of 5 children and she brought us up. My dad was a postman, so we never had a lot of spare money. Things were really tight, but she really showed me and my brothers and sisters how to make the best use of what we've got. And that's something that I try and instill in my 2 children as well. So certainly for me, my mum is my queen.
And are you a mum to a daughter as well?
I have a son and a daughter.
Son and a
yes.
daughter.
Yeah.
So you pass that through to both of them?
Absolutely.
Good stuff. Phillipa,
Yeah, I was going to say the same.
tell us about your mum.
Me mum. So no, she was a housewife. She did lots of work in the home, but actually she just championed us as kids, and she just made sure that we had whatever we needed. So yeah, she's a star. So she's my inspiration. And like Kath said, there's been loads of women and men throughout my career that have supported and helped. And you do develop friendships when you work, don't you? And you're in work a long time. So it's just making sure that we're creating cultures that staff can be happy at work and safe and happy.
Good. And I'll just finish off by saying International Men's Day is on November the 19th this year. We always mark that as well, so please keep an eye out for what we do around November, because we run it as part of Men's Health Month. So we'll be doing lots to help our colleagues look after themselves and each other. Brilliant. Thanks so much.
Thank you.
Thank you.
Thanks for joining us for this episode of our People podcast. We hope you enjoyed it and check out our other stories. Hit subscribe to keep up to date with the latest and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.